Hi, my name is Rich Roberts. I'm a medical doctor, a doctor of biophysics, and the former president and CEO of a pharmaceutical company. This is my fourth coronavirus YouTube video. In this video, I want to give you information that I've been receiving from multiple doctors, nurses, and other healthcare professionals across multiple hospitals in multiple states who are on the front lines. Then I want to talk quickly about hydroxychloroquine, a quick but very, very important update. We'll touch briefly on zinc. Then I'll tell you what's really going on at FDA on the inside. And lastly, a little example of some fake news. First, I want to tell you what's going on in the front lines. I'm hearing from many doctors and nurses that they are really quite demoralized. They're working long hours. They're absolutely overwhelmed with the influx of patients that is not only not letting up, but it's accelerating. And they're working themselves to exhaustion, which, by the way, is a great physical danger to them, because when people lack sleep, their ability to defend themselves, their immune systems against disease, is greatly reduced. There is a long tradition and history of medical doctors and nurses putting themselves in harm's way in order to serve their patients. And I have to say that this is this generation, or the last couple generations, and this younger and older physicians and nurses who are just working very bravely through all this at great peril to themselves. I've been told that some nurses that are quite tough people are very, very concerned now for their own health, their own safety. And there have been a lot of doctors and nurses who have been getting sick with coronavirus, and some have been dying, but they continue to soldier on to serve their patients. Now, some bad news about ventilators. When someone needs a ventilator, they absolutely need to be on it. However, when people are sick enough with coronavirus, which is many people, to go on ventilators, what I'm hearing from different hospitals is anywhere from 50% to 80% of the people who are put on ventilators are expiring. They're not making it. And much to the dismay of the physicians, these patients are expiring very, very quickly in a matter of days. And there's very little that the physicians can do to slow this. So I just want to be clear. I'm not saying that going on a ventilator is a danger. What I'm saying is, if people with coronavirus infection have become so ill that they need a ventilator because they are desaturating their blood, meaning the oxygen level in their blood is falling, that's a whole other scientific discussion, how the level of oxygen in the blood, it's for chemical reasons, it stays stable, even as the amount of air that someone is getting goes down and down, stays stable, and then all of a sudden it falls off a cliff. So when they start desaturating their blood, every physician and nurse knows that's a very dangerous situation. And with coronavirus, when they're getting so sick so quickly that they're desaturating their blood, and meaning they don't have enough oxygen in the blood, and they need to be on a ventilator, then what this is leading to is the virus spreading in a very malignant way, the immune system of the person trying to fight that virus, releasing a chemical called cytokines that stimulates all kinds of immune responses, and they're also getting, therefore, multiple organ failure, kidneys, heart, liver, and the people are expiring very quickly. And this is no doubt a significant reason for the despair. Although the physicians and nurses in emergency rooms and in hospital inpatient settings, in ICUs, are right now feeling overwhelmed and very dismal about the situation. In fact, the social distancing and quarantine measures are working. They are definitely reducing the number of people who are calling local physicians, their primary care physicians or healthcare professionals with symptoms and potentially being admitted to a hospital. So I think that the social distancing / quarantine efforts are now starting to bear fruit, and I think the hospitals are going to start to see a reduction in the acceleration of the rate of cases. but still there are a lot of sick people there. Some other things. We know that people over the age of 60, especially 70 or 80, are at the highest chances of expiring from this, from a coronavirus virus infection. What we are hearing, though, is people in their 20s, 30s, and 40s, or many of them are getting deathly sick, really sick. So even though people in those age groups will most likely survive this disease, many of them are going to be knocked out. Their energy levels, their abilities to fight off additional infections, they're really going to go through a lot of pain and suffering while they're sick, and the recovery period we just don't know about yet, but it looks like they're really going to be knocked back quite hard from being infected with this illness. Now, something interesting that they're finding in hospitals is that there are a number of adults that are coming into the hospital for other reasons, broken bones, whatever the other issue was, and upon being x-rayed, looking for something else in their body, it's being found that they have infiltrates, meaning small areas of pneumonia in their lungs, even though they don't have symptoms of coronavirus, and they are testing positive for the virus. Alternatively, there are a lot of children who are in similar circumstances, young children who are going into hospitals again for other issues like, broken bones or whatever the issue. And they're being tested for coronavirus, and in one report, they're all coming up negative. They're all coming up with no coronavirus. So there really does seem to be something about either the immune systems or the chemistry of people who are young that makes them much less susceptible to even being a viable host for coronavirus to grow in. Lastly, I want to say that in the Orthodox Jewish community of Lakewood, New Jersey, where I live in, there are many physicians who have now become ill, and some are hospitalized with coronavirus. One is at home, but he tells me that he can only speak about a half a sentence at a time. He can't get a full breath to even speak one sentence. Another one is in the hospital, needs oxygen, and we're praying that he recovers, but so far his situation has been worsening. Another physician, pediatrician, is at home, quite sick. He said he's been suffering in tremendous pain, and he's not gone into the hospital yet. He's trying to avoid it if he can, but we have a lot of physicians here who are falling victim to this virus. The last very interesting report I want to give you from a family practitioner, general internist who treats the public outside of a hospital setting is that even more common than symptoms of coronavirus infection are patients who are contacting him with anxiety-induced reactions because they're scared they have coronavirus. And he's actually giving out more they're called benzodiazepines, drugs to reduce anxiety. Valium, lorazepam, there's a clonazepam, there's probably dozens of them. But he's trying to treat the anxiety in patients even more than he has to take seriously ill patients to deal with them. And what his advice is that if you don't have a fever, don't worry about it. If you don't have a dry cough, don't worry about it. And in terms of shortness of breath, there are people get anxiety. I can't breathe. He said, if you can walk across the room without losing your breath, if you can do normal activities without gasping for air, then he says you're not having shortness of breath. And as I discussed in a previous video, if someone develops a loss of the sense of taste or smell, that can be caused by any virus, but it's generally rare to see, and it's happening in a large percentage of coronavirus cases. But for those who are not having difficulty with their breathing interfering with their ability to do just regular activities, small chores, then it might be you just need to calm down. Just calm down a little. If you don't have a fever and you're able to do things around the house, then this really is almost certainly not coronavirus. And if it is, you'll get a fever and you'll be able to see a doctor later. Now, hydroxychloroquine. I did an entire video on this. I talked about how correlation does not prove causality. I really want to tell you that hydroxychloroquine is enabling people who are really sick with coronavirus to quickly get better, get up and get out of bed and get out of the hospital. Unfortunately, that's not the experience that we're hearing. Now, this is not information that is scientifically definitive one way or another, but I can tell you that what I'm hearing across the board from multiple hospitals in multiple states is they don't believe hydroxychloroquine is actually changing the course of people's illnesses. There's the people that are, excuse the expression, it's used commonly among physicians. If someone's crashing and burning, hydroxychloroquine is not bringing them back. And the fact that many people get better, their symptoms improve, and they get better, and they leave the hospital, or they never have to go into the hospital in the first place, and their fever goes away, well, guess what? That happens taking nothing. We know that, right? We know that under the age of 60, according to the numbers we have, which admittedly, most of them were originally from China, and then they look worse in Italy. But generally, people under the age of 60, 99% are getting better with no treatment whatsoever. Which, by the way, is the reason why someone should be very cautious when some doctor claims like, all of my patients are getting better and I'm giving them, hydroxychloroquine and azithromycin. Well, wait a second. Almost everybody gets better anyway, unless they're over the age of 60. And especially over the age of 70 or 80, or forget the age, if they have other medical disorders such as diabetes or high blood pressure or respiratory diseases, chronic respiratory diseases like COPD or history of heart attack or other cardiovascular disease. Most get better anyway. But I am disappointed to tell you that so far the physicians who've been on the front lines are telling me they're not seeing any miraculous turnarounds that they can attribute to hydroxychloroquine. Now I'll speak about zinc. That was the subject of another one of my previous YouTube videos. I'm taking zinc 15 to 30 milligrams a day. I get it in a multi-mineral formula. But you'll find if you have a multiple vitamin with minerals, look on the label. Almost certainly, if it has minerals, it'll have zinc in there. Make sure you look at the servings. It'll tell you how much zinc you get per serving, but you have to look at how many tablets or capsules are in a serving. Sometimes it's 1 capsule or tablet, sometimes it's 6. So you need to know how many tablets or capsules you need to take to get a full 15 milligrams or 30 milligrams of zinc. Once again, I don't give out any medical advice. Talk to your medical professionals, but personally I'm taking 15 to 30 milligrams of zinc every day. Will it work? I don't know. There's an old fundamental adage in medicine, which is doctor do no harm. And I don't think there's anybody who's going to tell you that by taking the 15 to 30 milligrams of zinc, especially with the other vitamins and minerals that are generally in these formulations, I don't think there's anybody who's going to tell you that that's harmful. Whether it's helpful, we don't know. But yeah, I'm taking it. Now, I want to talk about the FDA. As I've told people previously, I was the president and CEO of a pharmaceutical company for 24 years. I dealt extensively with FDA at all levels, many different departments, many different issues. And I still have contacts that allow me to get a view inside of FDA. And that's what I've accessed for this video. Let me first tell you, FDA has not approved hydroxychloroquine to treat coronavirus. And the idea that FDA would approve hydroxychloroquine to treat coronavirus makes no sense. It makes no sense and makes no difference. As I told you previously, medical doctors can prescribe any drug for any ailment that they want to. It doesn't matter whether or not that drug is FDA approved for that ailment or not. And that is a perfectly normal part of the practice of medicine. Also, President Trump did not, and Vice President Pence did not approve hydroxychloroquine for coronavirus. It would be the FDA that would have to do it. And I don't think there's any company that's going to even apply for that application for the lack of financial motivation to do so. What FDA did do is that there are national stockpiles of certain drugs that the government accumulates in case there's a crisis in the country where those stockpiles are needed. So FDA has authorized the release of hydroxychloroquine from the stockpile, both for studies that are going on for coronavirus, or doctors that want to prescribe it for coronavirus, so the drug will be there, but also for approved uses and ongoing uses by patients who need this medication and has been cleared off the shelves, such as for rheumatoid arthritis and lupus. And of course, for the small number of malaria cases in the country, or people who would be traveling to malaria-infested areas. Now, what I've been told is that there has been a lot of political pressure on FDA to approve hydroxychloroquine for coronavirus. But as I told you previously about career employees versus political employees, political appointees in regulatory agencies, there's no way that the long-term career employees of the FDA are going to approve this without there being a fully vetted, a double-blind, placebo-controlled study. And I do want to say that I am very much looking forward to not only data coming in from physicians and hospitals doing their own maybe informal studies from all around the country, but especially when there really is or are some double-blind, placebo-controlled, randomized studies coming in, because there really is a real significant chance that hydroxychloroquine simply doesn't work. Even though it makes a theoretical sense, this will only be one in a long line of thousands of theoretically sensible cures or treatments that, when actually studied in patients, doesn't work. And just as a quick aside, I want you to understand something. Linus Pauling is one of the most brilliant scientists of the 20th century. He's the one who discovered electronegativities that were really responsible for the periodic table. If you know the periodic table, how atoms are organized on that. He won at least one, maybe two Nobel Prizes. And then in his elderly years, senior years, he tried to get into medicine. And he's the one who came up with the idea that vitamin C helps to treat colds and boost up the immune system. And his ideas, I attended a lecture by him in person once. His idea had to do with vitamin C as the precursor for this chemical reaction, which makes this. He also thought it would help to stop cancer. He was wrong. The clinical studies on vitamin C show that it doesn't help to prevent infections. But the reason why he and other people in physics and chemistry and those other hard sciences, the reason why many of them fail when they try to extrapolate their reasoning processes into medicine is because they don't understand the complexity of medicine. In other words, if you do an experiment in physics, you have a ball, it goes down a slide, the slide is a certain height, a certain amount of resistance, it goes off the slide, gravity is constant, you can predict where it will fall, all the way up to experiments with particle accelerators, and they collide and they're making circular tracks in cloud chambers to measure their mass and their energies. These are single factor experiments. What they don't understand is that biological systems, human beings animals, even bacteria, are composed of an enormous amount of molecules that are arranged in an enormous amount of different ways, of which we only have knowledge of a tiny fraction of them. For example, the number of proteins, the number of types of proteins that exist in the cells, in human cells, are probably in the range of over 10,000. And yet understanding the structure, the detailed molecular structure of them, we're probably in the range of a couple dozen that we understand. As a matter of fact, my doctorate thesis, I worked on the structure of the molecule that sits in the membrane of cells of mammals. I did both human and rabbit. That is responsible, rabbit and rat. That's responsible for the electrical signals that occur whenever somebody thinks or when somebody does anything, when any muscle contracts. It's called the sodium channel. My entire research just did a tiny piece of research into the total structure of that one protein. So biological systems are so much more complex than just a simple, do this chemical reaction and that's what will happen. As I told you about zinc, you think, oh, you put more zinc outside in the body, increase zinc in the cells to some degree. But for the most part, zinc can't get in the cells. And then once it does get in the cells, there are proteins in the cells that bind the zinc up and don't let it float around freely to try to suppress replication of coronavirus or other mRNA viruses. So you just can't assume that simple, straight 1 + 1 = 2 doesn't work when there's not just one or two other things, thousands of other things interfering from all kinds of different directions with that calculation. So I anxiously await the results of double-blind, placebo-controlled studies on hydroxychloroquine because it's not clear that it works. Lastly, I want to leave you with a message, a WhatsApp message that I sent to my family in late January. And it goes as follows. And the reason for my telling you this is because I want you to understand that you have to be very careful about what you hear out there. You have to be very careful about messages that people want to feed to you about this and true about anything else. From late January. If any one of you has not been following the coronavirus threat, then please watch the ABC News video that I'll post below. It ends with a statement that the flu is a bigger threat. That's what government health authorities are saying. It concerns me that the government is trying to stop panic. Of course flu is worse right now because coronavirus just started. It seems to me that the number of cases are doubling every day or two. There are no drugs for coronavirus like Tamiflu for the flu. The report says that clinical trials for a vaccine could start in 3 months. They're not telling you that. They're not telling you that the earliest that a vaccine can be proven to work and be scaled up for production is a year, and well before that time, the entire world could be infected. Since it is contagious during the incubation period of 10 to 14 days, I don't see how to stop it unless everyone wears masks and goggles. I don't know what will happen, but it's a real threat. So what I just want to say to you is, if people, be careful about believing what you're told, especially from illegitimate sources, but even with the national news, they only know what they're being fed. Get your information from many sources. Try to integrate it. But I can tell you this for sure. Social distancing and quarantining is working. It's helping to reduce the number of new cases. But I do firmly believe that virtually everyone eventually will get infected with this virus. And until we find whether it's hydroxychloroquine or one of the antiviral drugs that are being in tests now, and there are many of them being tested. Unless and until we find that one of these drugs works, we really are going to have a real challenge to deal with here, and it's not going away anytime soon. Please stay safe and stay healthy. Thank you.